My journey back to intimacy after prostate surgery. All right, guys, let's be real for a second. When it comes to prostate surgery, the first thought is probably, will I ever get back to my old sex life? Trust me, I've been there, and spoiler alert, yes, you can. And today, I'm sharing my personal journey on how I made my way back to intimacy after prostate surgery, so stick around, because you're not going to want to miss this. When I first woke up after my prostate surgery, I wasn't just physically drained, I was emotionally wrecked. The reality hit me hard. My prostate was gone, and I didn't know what the future held for my sex life. I went into surgery knowing there would be challenges ahead, but I hadn't expected just how much it would affect my confidence and my sense of self. I remember feeling lost, especially in those first few weeks. My partner and I were both dealing with the aftermath of surgery in different ways. She was incredibly supportive, but I was withdrawing, unsure of how to navigate this new normal. And that's the thing. No one really talks about the emotional toll this surgery can take. It's not just about the physical recovery, it's about rediscovering yourself in the process. The first couple of weeks were all about healing. Physically, I dealt with some pain and discomfort, but emotionally, I was grappling with bigger questions. Would I be able to be intimate again? Would things ever feel normal in the bedroom? These are questions I know a lot of you have asked yourselves, and let me tell you, it's normal to feel that way. But here's what I've learned. Recovery is about more than just physical healing. It's about rebuilding your confidence, bit by bit. And to do so, you must understand the impact of surgery. One of the most important things I learned early on was understanding what the surgery had actually done to my body. I had a radical prostatectomy, which meant the entire prostate was removed. With that came nerve damage, and let me tell you, those nerves are crucial when it comes to erections. For a while, I couldn't get an erection at all, and it scared me. I was afraid to even talk about it. But once I sat down with my urologist, things became a little clearer. He explained that the nerves responsible for erections run close to the prostate, and during surgery, those nerves can be damaged. But, and this is important, nerve damage doesn't always mean permanent damage. Nerves can heal, and while it might take time, there's hope. Understanding the why behind my symptoms helped a lot. Instead of feeling powerless, I felt like I had a roadmap. I knew there were steps I could take, treatments I could try, and that I wasn't alone in this journey. Now, the next step was to have open communication with my partner. If you're in a relationship, let me tell you, communication is everything. I wasn't great at this in the beginning. I shut down. I felt embarrassed, even ashamed at times. But I quickly realized that shutting my partner out was doing more harm than good. We needed to be a team, now more than ever. We sat down and had some difficult conversations. I told her how I felt, about my fears and insecurities, and she opened up about her own concerns. It wasn't just about sex anymore. It was about finding new ways to connect. We started focusing more on emotional intimacy. And I'll be honest, that made all the difference. Once we had that emotional closeness back, the physical side of things became less stressful. We learned to take things slow. Instead of diving right back into sex, we focused on affection, touching, cuddling, holding hands. It helped rebuild that sense of closeness without the pressure of performance. For me, that was a game changer. If you're finding this video helpful so far, go ahead and hit that like button, and don't forget to subscribe to the channel. It takes just a second, but it helps YouTube show this content to more men who might be going through the same thing. Be active in your therapy and recovery by exploring treatment options available. Now, I know what you're thinking. Penile injections sound terrifying. I was skeptical too, but after trying it a few times, I was surprised by how effective it was. The injections helped me achieve an erection, and while it wasn't the most romantic solution, it worked. However, I also realized that these weren't the magic bullet I had hoped for, as they came with adverse reactions. Another option I tried was the vacuum erection device, VED. Again, not the sexiest solution, but it helped with blood flow and gave me more confidence in the bedroom. I started seeing results, and that progress, no matter how small, made a world of difference. But when it comes to improving your sex life, I prioritize pelvic floor exercises, also known as Kegel exercises. Based on my experience, here are some tips, DOs, and don'ts. As someone who has been through this journey and as an experienced urologist, here are my personal DOs and don'ts based on my experience and the experiences of others. Do's. 1. Stay patient. Healing takes time, both physically and emotionally. Be patient with yourself and understand that setbacks are part of the process. It's important to celebrate small victories along the way. 2. Communicate openly. Talk to your partner about what you're going through. They're your teammate in this journey, and being honest about your feelings can strengthen your bond and provide the emotional support you need. 3. Explore all treatment options. Don't be afraid to try medications, injections, or even devices. Every little bit helps, and sometimes a combination of treatments works best. Be open to exploring what suits your needs. 4. Join a support group. Talking to others who understand what you're going through can be incredibly helpful. You'll gain insights, share experiences, and find comfort in knowing you're not alone. 5. Stay positive. It's easy to get discouraged, but staying positive is key to your recovery. Progress might be slow, but it's still progress. Focus on each step forward, no matter how small. Don'ts. 1. Don't expect immediate results. Healing is a marathon, not a sprint. Take it one step at a time and understand that it may take weeks or months before you feel like yourself again. 2. Don't shut down. Isolating yourself emotionally or physically will only make things worse. Keep the lines of communication open with your partner and your doctor, and don't be afraid to ask for help when you need it. 3. Don't compare your progress. Everyone's recovery journey is different. Comparing yourself to others can lead to unnecessary frustration. Focus on your own path and your own improvements. 4. Don't ignore mental health. If you're struggling emotionally, don't hesitate to talk to a counselor or therapist. Your mental health is just as important as your physical recovery and plays a significant role in your overall well-being. 5. Don't give up. There will be setbacks, but keep pushing forward. Here's an expanded version of the personal testimonial video script for my journey back to intimacy after prostate surgery, incorporating the elements of a personal experience with hooks, call to actions, and a more intimate narrative. If you're finding this video helpful and insightful, please take a moment to give it a thumbs up and subscribe to the channel. Your support not only motivates us to keep bringing you valuable content, but it also helps YouTube recommend this video to more viewers who may benefit from it. It only takes a second, but it makes a huge difference. Thank you for being part of our community.